Childhood Poverty and Health Disparities by Diane Sams, Cynthia Dorton, Jasmine Williams, Terry Morris, and Danielle Kelly, HCA 415, Instructor Nicole Vick. The average income and attaining an education used to be a problem simply for the ethnic or racial minority. In the year 2014, it is easy to see that poverty and health disparities are affecting the vast majority of the population. For this PowerPoint, we will be considering children from the southern United States of America, namely Mississippi. Poor children are more likely to go to bed hungry than any other demographic, and it is highly likely that these poor children do not have health insurance, meaning that they will not be seeing a physician. According to the Children's Defense Fund 2012, children are the poorest age group in the nation. Childhood poverty is defined as having an annual income of less than $23,492 per year for a family of 4. Poverty strikes every state in the nation, yet the state with the worst statistics for our nation's children is Mississippi. The South has the lowest economic mobility, and children who are born into poor homes are least likely to climb the economic ladder. Thanks to programs like Medicaid and the Children's Health Care Program, many children now have insurance coverage. The issue is that many physicians will not take new Medicaid patients because there's too much paperwork or it takes too much time to get paid. Psychological research has found that living in poverty has a wide range of negative effects on the physical and mental health and well-being of our nation's children. Poverty contributes to poor medical and mental health. Poverty hampers children's ability to learn and contribute to social, emotional, and behavioral problems. Chronic stress associated with poverty has proven to have adverse effects on the children's concentration and memory, which may impact their ability to learn. Some behavioral problems may include impulsiveness, difficulty getting along with others, aggression, attention deficit, hyperactivity disorder, and conduct disorder. Other emotional problems included feelings of anxiety, depression, and low self-esteem. Children and teens who live in poor communities are at an increased risk for many different health problems. Children have lower birth weight and chronic illness such as asthma, anemia, and pneumonia. Health problems associated with poverty are teens behave in risky behaviors such as smoking or engaging in early sexual activities. Risks are greater for those children who experience poverty when they are young and or experience deep and persistent poverty. Research has found that poverty is the single greatest threat to children's well-being. Poor children and teens are also at greater risk for several negative outcomes, such as poor academic achievement, school dropout, abuse, and neglect. Behavioral and social emotional problems, physical health problems, and also developmental delays. Also, poverty is linked to negative conditions such as substandard housing, homelessness, inadequacy, nutrition and food insecurity, inadequate child care, lack of access to health care, unsafe neighborhoods, and under-resourced schools, which affects our children. Effective public policies to pay for low-income parents and provide high-quality early care and learning experience for their children can make a difference. Investments for our most vulnerable children are critical. The 10 essential public health services codify the responsibilities of public health professionals. Their mission is to promote physical and mental health and prevent disease, injury, and disability. Their primary function is to focus on the population, including the poor and low-income families. Their first essential service is to monitor health status to identify community health problems. They identify any health threats and assess what health services are needed. They pay close attention to vital statistics and health status of specific groups that are at a higher risk, such as those who live in poverty or low-income families. The second essential service is to diagnose and investigate health problems and health hazards in the community. They look into the illness and disease that occurred due to in poor conditions. They also provide material and resources to those families that could give them support and help. The public health will also inform them of programs to assist them in making sure that their children receive the immunizations to protect them. Assurance is a function of public health, involves enforcement of legislation that was put in place by policymakers. This assures that the necessary services needed by the public are being utilized to achieve the goals that were set by the local, state, or federal policymakers. Assurance is instrumental in addressing community issues like poverty and health disparities through programs that will normally fall under the Department of Family and Children's Services, depending on where you reside. However, Medicaid, food stamps, WIC, child support, preventive health and immunization programs, and services can fall under one agency such as DFACS. Qualified and trained professionals are essential to the assurance process because it is important to the individuals and communities where these services are needed for overall public health. If an agency is dysfunctional in any area of operations, it will reflect in the customer service. That is why periodic evaluations is done by public health officials and policymakers to assure implementation of public health programs are meeting in the initial intent and overall goals within the low-income or poverty-stricken communities. Improving the health of the world's poorest people is one of the biggest problems in today's society. The systems today are all about trying to improve policy and actions to help child poverty and health problems that are caused by poverty. Many policy approaches focus on poverty, equity, or human rights in the relation to health and sometimes have been viewed as conflicting or competing against the richest and the poor. UNICEF launched a global study on child poverty and disparities in September 2007 to strengthen the profile of children in the national policy table. The study aims to influence the economic and social policies that affect resource allocations in hopes to make children a priority in the national programs, addressing the poverty of families raising the children. The study addresses the health, education, and protecting the needs of children living in poor, vulnerable households, unsafe circumstances, and disadvantaged communities on the global study on child poverty. The UNICEF organization works to improve social inclusion, policy, and budgeting, and also performs studies comparable analysis on child poverty and disparities in nutrition, health, education, and child and social protection through national and international partners. Listed above are all the key factors that many existing policies and development actions have focused on to help child poverty and health disparities. Other research has assessed a variety of approaches to reducing health inequalities, including reforms in the way healthcare is financed, and organized improvements in the quality and accessibility of services and more forced community development. We look to improve childhood poverty by whether we know it or not, while an adult may fall into poverty temporarily. Falling onto poverty into childhood can last a lifetime. There are millions of policies that organizations have formed to make childhood poverty decrease over time, but large disparities in health persist within the United States and other countries. Governments have made strides in improving public health over the last decades. Many initiatives to improve the health of the poorest people have been unsuccessful. Child poverty is a complex issue that cannot be achieved with a single facet approach. The system and policies have to work together to get improvement, and the key essential can help us get there. We have to inform the organization on how to educate the children at a young age and empower them regarding how important it is to stay in school and find a career that will continue to promote with lower unemployment rates and provide for their families. Many groups such as the Southern Law Poverty Center is set up to help with policies to help with harsh juvenile systems, thinking that harsh punishments that push children out of school and end up in poverty. There is still much to be done, but there is progress to be made every day, considering poverty will continue to be a factor in the world and the days to come. There is a saying that says it takes a village to raise a child. Many communities partner together to keep the local kids involved off the streets and safe from drugs and danger. All the key essentials are there daily to help with the system, and many changing policies that are being revised daily.